My name is Russ Derry. I'm the Director of Education at Epilepsy Foundation of Michigan, and the topic today is stress management and relaxation techniques, and we're very happy to have with us today Andrea Thomas, who's a psychologist with Henry Ford Health System's Comprehensive Epilepsy Program. Andrea, thanks for joining us. Can you give us a brief overview of your clinical and research interests and also your experience with this particular topic?
Sure. Well, I've always worked in the area of epilepsy. That's really been my focus since my very first job. And I think looking back, stress has probably been an important part of that. It's something that everybody really needs to be very aware of. So I don't think there's anyone that I see, whether I'm doing a group or individual therapy or any type of program, where stress doesn't become a factor that we try to address, because this is a stressful time to be alive, and stress really it's kind of minimized. I think people hear the word so often, it's like, oh yeah, well, who isn't stressed? But stress really, I can never emphasize enough with people that stress really, really is a dangerous thing when it gets out of hand. So I guess I could say that my experience with the topic of stress management it's pretty much ongoing, has been for a very long time, and is pretty much an ongoing thing day to day.
Okay, great. So let's start by talking about what stress is. Can you give an overview of what stress is, what the differences are between acute stress and chronic stress, and then how stress can affect overall health?
Mm-hmm. Well, basically, stress, individually, stress can be, different things to different people. What I might get stressed over or Russ might get stressed over may not be what the rest of you would get stressed over. But basically, when we become aware that the level of demand on us, on our mind, on our bodies, is greater than our ability to meet that demand, we're in a state of stress. So stress is synonymous with change, imbalance. Basically, you just feel like you can't meet the demands that are being put on you. Acute stress, everybody's experienced this at one time or another. Something happens. You may lose a loved one. You may, have some major change come up in your life, and you're going to feel the stress from the moment that you hear about it for a period of time. But then, as time goes on, the stress decreases, and you are back to whatever your normal state is. Chronic stress is stress over time. It can build for days, for weeks, for months. It can build for years. And so we all have a threshold for stress. We all have a ceiling for stress. And it's when you are near or at that ceiling that your brain and your body basically say, enough, can't handle this, and it starts to affect, it affects you in physical ways. And it's when the stress is chronic, and it's when the body starts turning it into health issues that stress is the most dangerous. And unfortunately, some people don't recognize it. And when they've had chronic stress for a long period of time, it seems like that's normal. It's like, this is the way I am. And when stress becomes a normal state, that's, again, when it is the most dangerous. Now, how does it affect overall health? Well, one of the first targets of stress is your immune system. If we don't have a healthy immune system, we can't fight just the, run-of-the-mill colds and flu and viruses that come down the pike. But the more chronic the stress is, the body systems actually begin to change and break down. And so people who already have health issues, for example, if you have epilepsy, stress lowers your seizure threshold. If you have asthma, you're likely to have more flare-ups. Whatever the health problem is, stress is going to cause it to become more of an issue for you, a more frequent kind of problem for you, because it's gradually, literally attacking your body. So it can affect blood pressure, it affects heart rate, it increases cholesterol levels. Even at the most basic cell level, stress will change how the cells are active. And so this is not a good state to be in. It increases the release of a hormone called cortisol, and cortisol is helpful if you are in a situation where we've all heard of the fight or flight response. You need to get away from something dangerous, or then cortisol is helpful as it courses through your body. But most of our stresses are mental stresses, and so that then the cortisol becomes a dangerous thing to have in your system. Chronic stress also leads to the inability of the brain to produce serotonin. Now, serotonin is a mood stabilizer, and low levels of serotonin are associated with symptoms of depression. So, these are all ways that stress, can literally make you sick.
Right. And you mentioned how when you're under chronic stress, you often don't even realize it. What are some tips for actually recognizing that you're under chronic stress?
Well, when people tell me, if I'm seeing someone for the first time and they say, I don't even really know why I'm here, the doctor sent me, but I think I'm fine, I'm not stressed. And I might say, well, you look a little tense, or there are usually obvious signs to me, and that's when they'll say, that's the way I always am. So at that point, they can't tell the difference between levels of stress. And when you are in a good place, you notice the stress as soon as it starts to build. So maybe, for example, you're someone that holds a lot of stress in their neck and shoulders. So if during the course of the day you notice that your shoulders are kind of tense, you feel your muscles a little tight, you're able to say to yourself, okay, I can feel myself getting stressed, I need to do something. If you aren't able to pick up the early signs of stress, then it's just going to keep escalating until a point where, it's out of control. So when you're trying to manage that, you need to start to practice stress management techniques. We're going to talk about those later. And you need to do them on a regular basis so that you're bringing your stress level down to a point where you are now going to be able to notice, okay, I'm half as stressed as I was, or I didn't feel stressed, but now I'm starting to feel my muscles tense up, or I'm getting a headache, and that's when you can still do something about it. You can still decrease the level of the stress more easily.
Right. So probably when people have been under chronic stress and don't recognize it, it ends up being physical health problems or depression or more serious problems that finally get them to recognize that they may need to...
Absolutely. Usually a combination of all of that.
Right. Okay. Well, no one can eliminate stress from their life. That's impossible. But there are things that we can do to manage it, as you said. So let's talk about some of the different ways we can manage stress. One major type of strategy would involve changing the situation that's causing stress. So, for example, let's say you had a coworker who was causing a lot of stress because she was very critical of your work, and every time you interacted with her, she was complaining or criticizing the quality of your work, and that caused a lot of stress. The few different ways you could change that situation would be to choose to avoid that coworker as much as possible. You could choose to talk directly to that coworker about how her behavior was affecting you. You could talk to a supervisor about the coworker's behavior. So those would all be different ways you could change the situation, and that might then lower the level of stress that you're under. Can you talk about some other specific stress management techniques that would fall under this category of changing the situation?
Sure. And, just, for many who maybe don't relate to a work situation, you can maybe think about, you could have an issue with a neighbor, and, then it makes it difficult to even go outside and run into this person because now there's this conflict between you. There are several different ways where you can change the situation because it depends what's really underlying the problem in the first place. For example, a lot of people have difficulty managing their time. And it can, again, be in a situation like a work situation or, something else other activity you might be involved in. But it can also be for people who don't have a specific place to go every day, but they find that they can't organize themselves. They can't organize their activities. They can't organize their time. And so even simple things that you might want to do at home don't get done. And you look and you think, oh my gosh, all this time has gone by and I still haven't done this. And then someone else might say, well, what was the problem? You were home all day. Why didn't you get that done? So a lot of time it's a matter of learning to manage time better, organize your thoughts, organize the things that you have to do. Communication skills become very important because when we're stressed, we often misinterpret what somebody says. We take it in a way that it wasn't intended. And, communication is two things. It's speaking, but it's also listening. And it's the listening part of it that we tend to have more difficulty with. People oftentimes need to become more assertive when they're feeling stressed. Being assertive is not being aggressive. Being assertive just means learning to stand up for yourself, have more confidence in yourself, know that you have the right to think what you think and say what you say. Other people don't have to agree with you, and you don't have to agree with them, but you have the right to your opinion. So being more assertive can help a lot of times, dealing with a stressful situation. Because the biggest part of stress is feeling like you are helpless, you are overwhelmed. And, sometimes getting another opinion on how to solve a problem, if you're feeling like, I don't know where to go with this, I don't know what to do, sometimes it can help if you're able to talk to someone that either has, experience with the issue or even sometimes just a friend who can help you problem solve and figure out a reasonable solution.
Right. Okay. So another broad category of approaches would be changing how you think about something that's causing stress. So going back to that difficult coworker example, let's say that your typical reaction to her criticisms was to think that, she must be right, and I must not be doing a good job. Maybe I'm going to lose my job. Now you're worrying about that all the time. Instead, you could choose to think about her criticisms as being inaccurate or based solely on her personal views and not a reflection of your actual job performance. So that would be a way of changing how you think about the situation in order to reduce the stress that it's causing. Can you talk more about some approaches to managing stress that involve changing the way you think?
Mm-hmm. Because basically we are what we think. So if we have a positive feeling about things, about ourselves, then, we're going to be in a much better place. But a lot of the time, as stress becomes more and more chronic, people start to lose confidence. They're not thinking as clearly, and they start to self-blame. They start to believe that somehow they must be the reason why things are going wrong or why things are not working out the way they want them to. So when we talk about changing how you think, it's a matter of people becoming aware that they are maybe negative, very negative, putting themselves down, and changing that pattern of thinking to be more positive about themselves. This is called cognitive behavior therapy. And CBT is a very common form of therapy. Most therapists today are doing CBT to a significant degree. Because if we allow our negative thoughts to continue, they start to become very harmful, because we really believe, like I said, we are what we think. We believe in the negative things. And so it's a matter of catching yourself, called thought stopping. You find yourself starting to say, oh, I never do. You stop. You don't even finish the thought. You replace it with something more positive. It takes time to acquire these skills. It takes time to develop them, because this is something, you have to be aware of all the time. Positive self-talk is very important, because what we think of ourselves is almost more important than what anybody else thinks, because it has a more powerful impact. So making sure that we don't let ourselves constantly be talking in a negative manner, and making a point of saying what we call positive affirmations. Some positive statements that you can say to yourself every day. You can write them on a little card. You can put it up on the bathroom mirror or the kitchen cupboard, and every time you see it, you repeat it to yourself. Something positive, something in the present tense. It doesn't have to be lengthy, but it's something that is going to be a more positive thought. And then it's important to take a reality check. When you find yourself thinking, oh, this person hates me because of this or that, you have to stop and say, okay, what proof do I have of that? Why do I think that? Because 9 times out of 10, you're not going to have any proof of it. But it's a belief you've come to accept. And basically, okay, this other person is right. I am the problem here. I am causing the problem. I am, a bad person. You have to really question that kind of thinking, and taking a reality check is a good way to do that. Just stopping right there and saying, how do I know that? What am I basing that on? Do I have any proof of that? Because if you don't, then you need to change that thought.
Okay, great. And lastly, and this is something we'll talk about more later as well, is you can manage the effects of stress. That's another way to approach it. Rather than changing the situation or thinking about or changing how you think about it, you can manage the effects. If the stress is inevitable, you can change how that affects your body by managing it. So with that same example that we talked about before, you might feel very tense after each interaction with that coworker. And to deal with that, you could decide that you were going to do a 5-minute breathing exercise after particularly bad interactions with her. Or you could do some physical exercise when you get home to help release your frustrations. Those would be different ways where you'd be managing the effects of stress. What are some effective approaches to managing the effects of stress? And we'll demonstrate a few of these as we get later in the call.
There are many, many, many stress management techniques that are very, very effective. The first step is to accept the fact that you need to do it. And I usually tell people, if I'm working with someone in a stress management program, I'm going to introduce them to a number of different techniques. Now, they may not like all of them. All of them may not be effective. We're all individuals, and, we're going to find different things to be more helpful, than others. And so I encourage people to try different things and then find the ones that work for them and do those on a regular basis. You have to take stress management very seriously and practice your techniques every single day. Now, people will argue that they don't have time. I'm busy, I've got things to do, I've got kids to take care of, I've got a house to take care of, I've got a job to go to. But you have to make the time, you have to carve that time out, because if you don't manage the stress, you're not going to do any of those things well. So finding the time, even if it's a few minutes, I mean, ideally 30 minutes a day is a great plan to have, but if you can only take 5 or 10 minutes at different times during the day, that's okay too. Because the more you do the techniques, the better they work for you, because what you're trying to do at all times is to create a relaxation response. The stress response is there from the moment we're born, and it never leaves us. It's automatic. The relaxation response is learned. So you have to teach your body, just like athletes do when they're preparing for an event. So there are very specific relaxation techniques. Some people feel relaxed if they're reading. Physical exercise is amazing because when you are physically active, the brain releases endorphins. Endorphins are natural mood stabilizers. So this is why you can be really upset, really angry about something, and maybe go and work out, go on the treadmill, go for a swim, go for a walk, and your level of stress will be less. It's not that the problem's solved, but you're going to be able to work on solving the problem much better when you're calm. Things like yoga, Tai Chi, those are very helpful activities. I personally like yoga. I do yoga, so I find that, to be very helpful. Probably the most amazing two things are art and music. Art and music are just wonderful ways to release feelings and to release thinking and to take your mind off the problem for at least a period of time. Art therapy and music therapy are things that a lot of people benefit from, but you don't have to be an artist or a musician. You don't have to have the talent. You just have to have take some time and allow yourself to get involved. It's more about the process than the final result. And I've certainly seen amazing results in art therapy where people were very reluctant in the beginning. Oh, I can't draw, I'm not an artist. And then as time goes on, you step out of your comfort zone and you realize that you're having fun doing whatever it is. It's a distraction, or it's allowing you to take the feelings you have and put it someplace else. Put it on paper, put it on a canvas. Or music, whether you're just listening to the music or you're playing an instrument. Music affects the brain. Music can change the brainwave activity. They've done a lot of studies with EEG showing that brainwave activity can slow down when people are listening to some nice relaxing music. Keeping in mind here, we're not talking about heavy metal, hard rock, any of that, or music with lyrics, because sometimes lyrics can be a trigger. Sometimes you're so caught up in that you're not benefiting from the actual music itself. Relaxation music is usually something slower. It's not a song that someone's singing, but it's a piece of music that you're listening to. And much of the music that is used for relaxation as background, the beat is reminiscent of the human heartbeat. So it can be very soothing. and the brain falls in sync with that. So I personally think art and music are just two of the most amazing things to allow us to just release what we're feeling and what we're thinking. And then one more thing, for those of you who are animal lovers, who have pets, you know what a difference it can make to have that companionship. And again, studies have shown that pet therapy programs in hospitals, in nursing homes, in facilities for children make a huge difference. Sometimes a person who can't even verbalize anymore, but having, the opportunity to pet a dog, to have that dog show them some affection, can bring them out of themselves, bring them out of a more severe state of depression, and just make them feel better. So that's also very important. And then just spending time with people. When we are stressed and depressed or anxious, one of the first reactions is to isolate yourself. I don't want to talk to anybody. You stop answering the phone. You stop going out. You stop, interacting with people because it can become just too much. And actually, it's the interaction that can help to diffuse things sometimes and decrease the intensity of feelings.
Right. And for those who are interested in art therapy, we do have our Studio E Art Therapy program, which will be offered in both Detroit and Grand Rapids. It's a 6-week program, very effective, and I think the real benefit is that it works on a couple of different levels. You have the immediate stress reduction of being involved and absorbed in something that takes your mind off of it, that is relaxing by its nature. And then you also have the fact that you can express yourself and start to work through some problems and internal conflicts, and also learn from others and how they deal with things. And so it works on multiple levels, which I would definitely encourage anyone to contact me if you're interested in that program. So managing stress is clearly important for everyone, but for people with epilepsy, it's even more important, partly because living with epilepsy can create a lot of stress, and partly because stress is one of the most common seizure triggers. So can you talk more about the unique relationship between stress and epilepsy?
Mm-hmm. Sure. Stress creates a cycle of fear and seizures. Anxiety, stress will cause a seizure. Having a seizure creates more anxiety, or it may trigger depression, and that again will lead to fear of having the next seizure. And so it becomes like a vicious cycle where this just continues to happen, and the two kind of feed into each other. Stress increases the frequency and intensity of seizures. There are certain times of the year, like towards the holidays, between Christmas and Thanksgiving, people will report having more seizure activity, or they will say, for the last few weeks, I've just been having seizures every day, and well, is there anything changed? Is anything going on? Well, yeah, my daughter's getting married, or I had to go and I had to do something. So, they're likely to you're at greater risk to have a seizure during a time of stress than at any other. Stress also increases the recovery time from seizures. So if you normally may come out of a seizure within a few minutes, if you're under a lot of stress, it may take longer, and sometimes the recovery time can be a lot longer than the seizure itself. And even to the point where when we have people who are considering epilepsy surgery, we look at the total person. If this person is struggling with a lot of depression, it is not at all unusual for the surgeon to say, I'm not doing any surgery until their depression is better managed or they're less anxious. Because looking ahead, the surgery itself may be very successful, but the recovery time, the healing time can all be increased because someone is going through a lot of stress at that particular time. So very much of a physical connection there. Intense emotional reactions are common, so I've certainly seen people that I've been with in a therapy session, and if we start talking about something very uncomfortable or something, very frightening, it's not unusual if they go into a seizure. The emotional reaction, that stressful reaction, is a common trigger. So people worry about having the next seizure. They worry, if your seizures are controlled, certainly, that's not so much the case. But for someone who has seizures that are not controlled, then you don't know when that's going to happen. So you may always be worrying about, okay, so I'm okay this morning, but am I going to be able to go out today? Because what if I have a seizure? Where will I be? Will anybody know what to do? So that's certainly a trigger. And then medication. Having to take medication. Having to make sure you have your medication with you when you go someplace. Just being kind of chained to that. I have to take the medication. I can't miss it. I can't be late. So there's a lot of things about having the seizures and the treatment itself that can be triggers. And whether it's an acute or a chronic stressor, either one.
Right. And I think also there's some sense of loss for some people, particularly people who are diagnosed as adults. Because they may have had a job and a lifestyle before the onset of epilepsy that they're no longer able to do at the same level, or it's changed, and I think that must be a cause of stress as well.
Oh, definitely. It's all about loss because epilepsy takes things away from you. And so no one, especially a sense of control. And that's so important to all of us. I mean, it's all about control. We like to think that we have total control of our lives, and most of the time, that's not even close. So if you feel that something has taken this control away from you, that's going to be very disturbing.
So you mentioned fear of having a seizure, and certainly that fear is greater if your seizures aren't well controlled. But even if your seizures are controlled, you still may have that fear of that breakthrough seizure that can happen, or maybe it has happened in the past where you have that one seizure, mm-hmm. and then you lose your driver's license. It may affect your employment. It kind of puts everything in doubt if you have that one seizure. Are they going to come back full force? All of those things. So that fear is just for all people with epilepsy, I think, is something that you have to deal with. Are there any approaches to managing that fear that you found to be particularly effective?
Well, yeah, first of all, just acknowledging that it's there is important, because if you don't recognize it and accept it, you're not going to be able to work on managing it. But certainly, certain breathing techniques can bring down the level of anxiety. Things like meditation and visual imagery can very definitely have a relaxing effect. And, there's a number of stress management techniques, mindfulness, there's so many available, and the goal of all of them is to bring the stress level down to where you can manage it. We can't be totally stress-free, not in this day and age, but we can certainly get it to a point where we're able to manage it.
For some of these techniques, have you found that they can be effective if, for instance, if people have an aura or a simple partial seizure prior to another seizure? are people able to use these relaxation techniques on demand, basically, to avert or prevent that simple partial seizure or aura from progressing into another seizure?
Oh, definitely. I've had a lot of people, very happy to report that they started to feel a seizure coming on, or they had an aura, and they did just a simple breathing exercise. Calm down their breathing. You calm down the mind, you calm down the body, and sometimes that's the difference between going into a full-blown seizure or not. And when you know that you do that and it's helpful, then that really reinforces the fact that you can develop some control yourself.
So several aspects of the relationship between the person with epilepsy and family members can also be sources of stress. The person with epilepsy may feel resentment because the family members are overprotective, or maybe because they're not accepting or understanding or supportive enough. On the other hand, they may feel guilt because they feel like they're a burden to their families. So what are some of the keys to reducing stress associated with family relationships in epilepsy?
Yeah, and certainly that is a huge area. When possible, it always helps to, have a family member maybe come to the doctor's visit with you. Or it's not unusual for someone to say to me, "Can I bring my sister next time I come?" Or "Can I bring my husband or wife?" Or "Can I bring, one of my kids with me so that they understand what I'm going through?" Because people can't relate to something that they've never experienced. And I learned very, very early on in my practice to never even suggest that I know what it's like to have a seizure. I think I might have said one time, kind of suggesting that, I know what you're going through, and the person looked at me and said, "You don't have a clue." And it's true. If you've never experienced it, you can't really relate to it. But you can understand that, it's affecting your loved one in a certain way. So, education is important, whether you're having them come in and hear it directly from a doctor or a therapist, or whether you're getting written materials that they can read to get a better understanding. A lot of times the reaction from family members is based on their own fear. If you talk to the parent of a child with epilepsy, there is nothing in their imagination that could be as frightening as seeing their child having a seizure. And even with adults, someone who sees you starting to have a seizure, the first thing they feel is very, very helpless. Because what do we tell people? Don't do anything. Don't try to interrupt the seizure. Don't, try to bring the person out of it. Just make sure that they're, safe. But to stand there and watch something going on and know that you can't do anything to stop it, it's human nature. We see something like that, we want to take action. And so for any family member or even a friend sometimes, it's very hard to just stand there and watch until the seizure's over with, because they feel helpless. And when they feel helpless, they start getting anxious. And sometimes that anxiety can be translated as anger. It's pretty typical for everybody to worry about being a burden to their family. No one, wants to have to depend on other people. But I think we all have to try to put ourselves in that same position. If the situation were reversed and it was the other person having the seizure, would you be resentful? Would you not, want to do everything you could for them? And most of the time people will say, well, yeah, but that's different. Well, no, not really. It really isn't different. families become overprotective, and I see this not only with parents of young children, but oftentimes parents of adults with epilepsy who still may play a very important role in their, child's life, their adult child, and they want to protect you. So no, you can't go here. No, you can't do that. No, you shouldn't go out by yourself. And that can be very hard to hear because someone's taking your freedom away from you. And your epilepsy's already doing that. And then you have someone else telling you that you can't do something because you might have a seizure. So it's important, again, to kind of find a balance between the two. And that's where, maybe having the family member talk to one of us, talk to a healthcare provider or the therapist, and, relieve some of their own anxieties. Being a caregiver is very, very stressful, right? Because you're taking on responsibility for what may happen to someone else, not just yourself. And that puts most of us under stress.
Okay, so now Andrea is going to demonstrate a couple of exercises that you can practice and that can help with relaxation and help you to achieve a positive mindset. So if everyone can get into a comfortable position and, the TV's on, turn it off, and, just focus on this exercise. And you can also, this will be recorded too, so you can come back to it if you find it helpful to listen to it while you practice. That would be something you can do as well. So I'll let you take it over, Andrea.
Okay. And I'm just going to preface this by saying that, unfortunately, this kind of a situation with limited time, because you can certainly do relaxation techniques over the phone. I do it all the time. But when you have a limited amount of time, it's impossible to demonstrate everything. So in the essence of time, I just chose a couple of brief exercises. The first one is going to be a breathing exercise. Deep breathing is the basis for most relaxation routines, no matter what else you're going to do, whether it's meditation or visual imagery or progressive muscle relaxation. You're going to start by focusing on your breath. And the reason we want people to focus on their breath is because breathing is a natural, rhythmic process. We don't have to do anything. It just happens. But when you get anxious, your breathing changes and you're not even aware of it. You hyperventilate. And that means you take in too much oxygen. We're all aware of how lack of oxygen can damage the brain. But if you take in too much oxygen, because your breathing becomes shallow and rapid, and those of you that have had EEGs know that sometimes that's exactly what they ask you to do. Breathe quickly because they're trying to see if they can induce a seizure. So your blood pressure goes up, your heart rate increases, and your breathing becomes abnormal. So when you focus on the breathing, you actually bring all three of those down to normal. Because when your breathing slows down, so does your heart and your blood pressure comes back to normal. Okay? So this is called a 3-minute breathing space, and nobody can tell me that you can't find 3 minutes a few times a day to do this. And that's the beauty of this. You can do it anytime, anywhere, even in the midst of a hectic day. And it kind of takes you out of the automatic pilot mode, and you reconnect with the present moment. So the word to keep in mind is space, S-P-A-C-E, okay? So I want everyone to just make themselves comfortable wherever you're sitting. Just, be sitting erect, have your feet flat on the floor. Stop whatever else you're doing. You're going to enter a safe haven for 3 minutes, no matter where you are. So S is for stop. P is for preparing your posture. Have your feet planted on the floor, your back erect but not stiff. Allow your eyes to gently soften or close, whichever feels more comfortable to you. And this posture is actually the inner counterpart to being self-reliant, self-acceptance, patience, alert attention. A is for awaken your awareness. Become aware of your experience in the present moment. As you continue to breathe slowly in and out, what are you thinking about? How are you feeling? What physical sensations do you notice in your body? Simply acknowledge and accept where you are, here and now. And continue to breathe in and out. In and out. C is for concentrate. Redirect your full awareness to your breathing. Focus on the rise and fall of each breath, the movement of your abdomen, how it feels when you exhale. E is for expand. Expand your attention and feel your breath moving through your nostrils, stretching your diaphragm, moving through your entire body to give you a sense of the breath and the body as a whole. Just continue to breathe slowly in and out. In and out. And when you're ready, allow your eyes to slowly open and take this expanded awareness back into your day. The next thing that I'm going to do is a mindfulness meditation. Also very relaxing, and it's called Sitting by the Waterfall. Our thoughts are very powerful. They weave works of fiction that can sweep us into another world. And this practice offers a way of being with your thoughts without letting yourself be carried away by them. When you practice mindfulness, you're not judgmental. You are simply being aware and accepting it is what it is. And you don't hang on to the thoughts. They come and they go. So take the time to just settle into your seat. Make sure your feet are on the floor so that you feel grounded through the floor, through the earth. Connect to the place where you feel your breath most strongly and make that your point of focus. And just spend a couple of minutes watching your breath, watching it flow in and out, noticing its effect on your mind and on your body. In and out. Your breath is your anchor, and any time you feel yourself getting swept away by thoughts, use the breath to reel yourself back into your body. You can do this whenever you need to. Whenever you feel that something is pulling you away, distracting you, just focus on your breath again, and it will bring you back to the present moment. Now I want you to picture yourself at the top of a waterfall, sitting safely on a rock with a sense of the earth beneath you, supporting you. You might look around and see rocks or trees or bushes or other things that you could hold on to, but you are very safe sitting on this rock. The water is rushing by, cascading over the top, carrying your thoughts, twisting and turning in little whirlpools. And if you like, you can consciously place your thoughts in the water, maybe launching them out onto the current on leaves like little rafts. Some thoughts might get stuck behind a rock and remain in sight, but the power of the water soon pushes them on. As you sit on the rock, you may feel the water spray onto you, but you're not getting swept away. It's your thoughts that are passing by, tumbling over the edge, out of sight and out of mind. And you remain sitting, just watching them float by, concentrating on your breath, in and out. And when you feel comfortable, just open your eyes gently and come back to your surroundings. Russ?
Okay. No, I didn't fall asleep. Great. Well, that was very relaxing. And like I said, this will be added to our website, this recording, so people who want to listen to that and practice those exercises can do so. There are also a number of other websites, and you can go to the library for recordings of different stress management techniques, things like progressive muscle relaxation, other mindfulness exercises. So there's so many different things out there, and all of them can be effective, but like you said, practice is the key.
Absolutely. It's true. There are so many different options in terms of what you're going to be, what is your stress management regimen going to be. But the key to success is doing it every day. The biggest mistake that people make, they feel better, they say, oh, you know what, I'm not stressed anymore, I'm not going to do this. Well, what happens is over time your relaxation response weakens and the stress has an open door to come right back in again. So I tell people, you know, when you start doing this is something you're going to continue to do for the rest of your lives. You're going to keep your stress managed because we never know when stress is going to come at us from somewhere.
Right. Okay, so we've talked about day-to-day stress and how to manage it, but stress can also be a sign or a symptom or even a cause of anxiety disorders and mood disorders, things like depression, generalized anxiety disorder, panic disorder, things like that. At what point should people seek professional help for stress or stress-related disorders?
Well, I think if you realize that you are, for example, feeling anxious or depressed more often than not, then you know at that point it's having a major impact on your life. If you're at the point where you are having more seizures or developing other health issues, then that's a major red flag that you really need to do something about it. People have a funny idea sometimes about doing these things like, oh, well, you know, if I can't handle this, I must be weak. No, we all reach a point, every single one of us, where we may not be able to handle something as well. Because you've got a lot of factors, your health, the state of your health to begin with, and then how many seizures you're having, what kind of seizures you're having. So there is no shame in going and talking to someone and learning ways to be able to help yourself. So any time that, whether it's depression or anxiety or if you're having panic attacks, these are very disruptive processes, and they have a major impact on your daily life. And so you're actually showing great strength by saying, I need to talk to somebody. I need to get some professional help.
Okay. And how do people decide what type of mental health professional to see? There's many different options. And then also what type of therapy to seek.
Mm-hmm. Well, first of all, if you're just in need of therapy, talking to a therapist, that could be a psychologist, it could be a social worker. A psychiatrist is more necessary if there's going to be a need for medication. And sometimes there is and sometimes there isn't. If someone has a very severe depression to the point where it is disabling, or if their anxiety is so high that they can't think clearly, they can't sleep, they can't function, then that's a time to seriously consider at least a short term of medication. It doesn't always mean that you're going to be on it forever, but it can help you over the short period of time to kind of take the edge off things. Sometimes I feel that people can't even benefit from therapy if they're not on at least a small dose of medication, because they're so overwhelmed by everything. So if there's a need for medication, then it's definitely important to have a psychiatrist as part of your treatment team. But if that's not the case, or if you have a primary care doctor or a neurologist who's willing to maybe put you on an antidepressant medication or an anti-anxiety medication, then you don't necessarily need to also have a psychiatrist in the picture.
And then in terms
as far as what type of... go ahead. It's chemistry. I tell people that, sometimes you can be the best therapist and the most cooperative patient, but if they don't hit it off, it's like any other relationship that we have. It has to be the right fit. If you don't feel comfortable with someone, that is not the person you're going to share anything with. That's not the person you're going to want to talk to about your deepest, darkest feelings, because you don't trust them. And it's all about trust, and trust has to be earned. So you don't go to a therapist for the first time. Sometimes this happens. I've had people come in and say, "Oh, I'm so glad I'm coming to see you. I want to continue." And then yesterday, I had someone who said to me, "Well, yeah, I'll come back next week, but I don't trust you yet. I don't trust anybody. Trust is hard for me." And I said, "Of course, I understand that. I have to earn your trust." So it works both ways. If you don't feel comfortable with the person who is going to be your therapist, then you need to find someone else. Don't keep yourself in a situation where you're going to dread going every time, and then you're not really going to be engaged in the process because this person, for whatever reason, and it's not necessarily their fault or yours, but for whatever reason you don't feel comfortable with them. So you have to have that level of comfort with the therapist. And as for the type of therapy, well, we all tend to have our preferences. Some people will only do cognitive behavioral therapy, or they will only do interpersonal therapy. I personally tend to be kind of eclectic. I like to use what I think is going to work for each individual. So I use a little bit of CBT, and I use relaxation techniques, and I use the traditional talk therapy, And it's when I get a sense of what's going to be the most effective with this person. So again, we're all different. We all have our preferences. Again, you have to be comfortable with the type of therapy that's going on as well.
Right. And I think another important point is I think a lot of people assume that you have to have a diagnosable mental health condition to be able to use a therapist, but people can benefit from a therapist or counselor without having a diagnosis.
Right, because oftentimes the diagnosis may be depression related to a medical condition. If the struggles that you're going through with epilepsy or with some other health problem, if that is the source of your depression or your anxiety, then that is actually what the diagnosis becomes. It's related to your medical condition. Mm-hmm. If you didn't have that medical condition, you might not be feeling any of that.
Right. Okay, before we open it up to questions, do you have any closing thoughts on this topic that you'd like to share?
Yeah, I guess I can't emphasize enough how dangerous stress is. I tell people, at its worst, stress kills. At its least impact, it makes you sick. And there's really nowhere you want to be along that road. Because stress has such a profound impact on health, this is the thing that makes it so dangerous. Because once you start developing additional health issues, they have to be treated. They may have started because of stress, but that doesn't make them less real. It just adds one more thing to what you're already dealing with. So I really encourage people to pursue, whether you go to a therapist or not, but pursue stress management. Look it up online. There's so many websites that will give you visualization scripts, visual imagery scripts, or meditations to practice. Or you can get books, or you can get tapes. You can buy relaxation CDs, music. You can get sometimes, not that expensive. I mean, even the grocery stores have, relaxation music sometimes. So don't be afraid to try things. Look into it yourself, and then if you have the opportunity to get into a group, or to work with someone who can kind of coach you through this, it's really, really important. Studies have shown that people with epilepsy who had intractable seizures weren't responding to medication. They weren't surgical candidates, but learning progressive muscle relaxation had a phenomenal impact on them. It reduced the frequency of seizures, reduced the intensity of seizures. So it really, really is important.
Great, thanks. So I'm going to open it up to questions now. So I'll unmute everyone. So just take a second.
All guests have been unmuted. You will now rejoin the meeting.
Okay. So a couple people joined us. I heard a few chimes while we were muted. Is anyone on the call that didn't say who they or not announce your name? Did anyone?
This is Greg Schultz.
Oh, hi, Greg. Okay, thanks. Anyone else who joined the call late?
Matt Miller.
Hi, Matt.
Matt Miller.
Yep. Hi, Matt. Okay.
Hi.
So, who has a question or a comment?
I have a question.
I do, Russ.
Okay, a couple people there. So whoever spoke most recently, you can go, and then we'll have the other person go next.
This is Dee.
Yep.
Russ, I'm actually for Andrea, Dr. Thomas. I'm calling for my daughter, my 16-year-old daughter. Mm-hmm. Most of what you spoke about, I could relate or translate to her, like you were speaking for the examples about the people at work. I just kind of translated it to people at school for her.
Right.
Mm-hmm. But I have a question for you. If you could maybe define, she, I believe, suffers from anxiety and panic attacks. Mm-hmm. Could you define what, or explain to me what exactly a panic attack is, or define what a panic attack is?
Sure.
For me?
Sure. People will describe suddenly feeling very anxious. They're not even aware that their breathing has become fast and shallow, so they're hyperventilating. Mm-hmm. Then when they become aware of it, they may have a choking sensation, they may feel some nausea, some dizziness. It can even go to the point where they pass out, because basically they're taking in too much oxygen, not enough carbon dioxide. It upsets, the respiratory balance. And it can be so extreme that people will even be afraid that they're having a heart attack or they're dying, because everything's escalated. Their heart is beating out of their chest. Their blood pressure's gone sky high, and they're choking in their mind. Mm-hmm. And usually if a person has had 3 panic attacks, then it can officially be considered a panic disorder. But there are certainly the breathing technique. I've had a lot of people that have had a panic attack while I'm in session with them. The first thing I do is make them focus on their breathing, slow their breathing down, and you'd be surprised what differences you see in them physically when they do that.
Mm-hmm, mm-hmm.
Do panic attacks...
Okay, because we've experienced 2, so I'll kind of keep track of that. So, okay.
Mm-hmm.
Okay.
Do panic
thank
attacks
you.
necessarily have an obvious trigger, or do they sometimes just come out of the blue?
Well, it can be both. Okay. Once it's become like a regular response, I mean, the body will respond sometimes even to things that you'd say, well, that's not that stressful. But remember, we're talking about the mind-body connection, and any kind of stress. Something I should have mentioned earlier that was important that I missed is that there are 2 kinds of stress. There's the bad stress that we all know about, and there's also what they call good stress or eustress. And that's what we experience when we're having a wonderful time. We're at a party, it's Christmas, you're at a ball game, and the Tigers just hit a home run, and you're waving your arms, and next thing you know, you've had a seizure. And people will say, why did it happen? I was having a good time. I was out with my friends. Because after a while, the brain can't distinguish between the 2. Anything that excites your mind and your body is stressful. So the brain just knows, this is stressful, even if you're having a great time. That doesn't mean you shouldn't have fun, but it means you need to get your stress managed so that when you are having a great time, it's not going to cause any harm.
Mm-hmm. Also with panic attacks, simple partial seizures can often mimic panic attacks, either the autonomic response to heart rate, or also just feelings of fear that come out of nowhere can be very hard to how do you distinguish between simple partial seizures and panic attacks?
Well, I think if there's any doubt, I mean, we've certainly had patients coming to the clinic that were referred because they're having complex partial seizures, and then they'll see our neurologist, and the neurologist will say those are not complex partial seizures; those are panic attacks. And sometimes it's the other way around. So sometimes, that's not initially that's not a distinction you can make yourself. But if the doctor says, these are panic attacks, then it's important to know that so that you can do something about it.
Russ, that's a really good point, because that's what she has.
Okay.
She has simple partials, and I believe she's had complex partials as well.
Okay.
So
that might be something that a neurologist or a visit to the epilepsy monitoring unit might help to sort out.
Because if you start doing some stress management and you see a decrease, you're going to see a decrease in the panic attacks. Mm-hmm. And then, you're going to see a decrease actually in everything, and so that will kind of clarify it sometimes.
Mm-hmm. Okay. Good. Thank you.
someone
Oh,
else
you're
had a
welcome.
question earlier?
Yeah, my name is Lisa, and I'm a parent of a 17-year-old with epilepsy, and I was interested in your comment about music can change brainwave activity. Given the fact that she's 17 years old, she listens to a lot of music, and a lot of it isn't relaxing music. I'm wondering if there is research that suggests, particularly with teenagers, if they're listening to very, I don't know if she's listening to hard rock or whatever, if that can aggravate seizures potentially, as well as any comment about, the youth using phones and texting and whether or not that could have a negative effect on seizure activity.
Well, I'm going to be very honest and say I really don't know. I don't know that kind of music is going to trigger anything. I know it's not going to be relaxing. That I can say very safely. As far as like the cell phones and the texting, nowadays most young people, their phones are basically an attachment to their hand. So I don't know that that's going to cause more of a problem from a medical standpoint. Again, it's going to depend on maybe what they're texting about or how anxious they are to begin with.
Okay.
I personally think that everybody needs to take a little break from the electronics every so often.
Mm-hmm.
And, if you enjoy country music or rock or whatever, that's great. But once in a while, it's nice to just listen to something maybe classical or specific relaxation music. I use a lot of music in my therapy practice, tapes that I buy that are, flute or a certain type of more of an oriental, tone to it or instruments that are simply, it's just not your regular song, because we can be talking through that. We can be doing a technique through that. And it's simply background, but it's soothing.
Okay. Thank you.
A lot of it depends on what your response is to that particular music, and that's something you could talk to her about and say, does this music actually relax you, or does it get you more upset, or does it get you angry? Because, I know some people might listen to hard rock or heavy metal music and it gets them, really angry and wanted to bang their heads and that kind of stuff. So if that's the reaction that elicits, then it's probably not helping. But if she's listening to it because it's kind of an escape or a way to get away from the thoughts that she's having that are stressful, then maybe it can be beneficial. So I guess it's something you just have to talk with her about and see, and similarly with the texting, if it's something that is positive and it's a way of feeling socially connected, that's one thing. If it's something where they're gossiping about things that are going on in school and there's potential for bullying and that kind of thing, then it all depends on, I think, her reaction to those activities.
Yeah.
Okay. Thank you.
Other questions? Okay. Well, I'm going to pose a question to the participants. Would anyone like to share what you found to be most helpful in managing stress? Like your kind of go-to activity that helps you to manage your stress?
I can speak up, Russ. This is Dee again.
Yeah.
Well, again, I'm here for Jillian. I'm going to share with her. I'm going to talk to her tell her about the cognitive behavior therapy. I'm going to share that with her. I'm also going to play the relaxation part of it that Andrea did. I thought that was wonderful. I loved it.
Oh,
I did it myself. I thought it was great.
We can all benefit from it.
Yes, I thought it was wonderful. I loved it. So
Great.
that was what my takeaway.
Great.
Um,
Go ahead.
Well, I thought of another question. This is Lisa. Is it okay if I ask this?
Of course.
Sure.
My daughter is a senior, and she's going to be going away to college, which, as you can imagine, is a stressful, exciting event.
Mm-hmm.
And certainly a lot of these techniques you talked about, I'm hoping that she will use. I don't know how to ask this. She's been on a couple college visits, and when you were talking about good excitement, she had seizures on the visits, and she was very excited about being at the colleges, and I have some concerns about the initial adaptation and whether or not it's going to trigger seizures. Any thoughts about, like the college experience and what might be most helpful in,
I think what would be helpful is between now and the time she actually goes away to stay at school, if she can develop some kind of a routine. And when you talk about a stress management routine, it can include, a multitude of things. A basic breathing exercise, maybe someone who likes to swim or jog, as well as some things like visual imagery is very, very powerful. We were doing a little bit of that with the waterfall because you were picturing it in your head. And again, we are what we think. So if we are imagining ourselves someplace really, really calm and relaxing and we get really into it, you get to a point where you feel like if you open your eyes, you really are in a beach or someplace like that. So I think if she can put together, just a few things that she does on a regular basis and also becoming aware of getting excited. Sometimes, these things can be preventive. If you know you're going to be doing something, then beforehand, kind of, rehearse. Do some deep breathing, do a little meditation, and then imagine yourself in that situation. But see it as being very positive. I can handle it. I can do this. You can sometimes kind of prep yourself for being in a situation.
Okay, great.
I think also preparing for the change, the more you can do in advance, like if she's going to be living in a dorm, if there's any way to meet with the roommate that she's assigned to beforehand and get to know them, that'll be less of a sudden transition. Talking with the RA at the dorm so that they're aware of the epilepsy and can help with any unknowns or with seizure response if it's necessary. Knowing her schedule of classes in advance so that and kind of mentally rehearsing, okay, I have this first and then I have this, and even going to the campus and going through and walking and saying, okay, here's where I go first. So if you can kind of make that transition to having a new routine a little less jarring, that can probably help as well.
Okay, great.
Yeah, because change and stress really are synonymous, and as human beings, we don't like change. We like to, the predictable. We like to know that our day is going to be the way it's supposed to be. So a big change in a routine, can certainly become a stressful situation.
Okay.
Would anyone like to share any challenges that you've experienced or barriers to managing stress, things that you found most difficult about it?
Hey, Russ?
Yeah.
This is Greg. How you doing?
Good. How are you?
I was going to ask you something. You're talking about stress. Mm-hmm. I found if I can get out and I go somewhere, like on a bus to, like one time I went out to Pennsylvania and back, it felt great, to get out and go somewhere. But people want me to, to take part in rehab, and that's where I get upset. You know, anything like school, I get kind of tense about it.
Okay. Okay. So it sounds like you found something that is helpful for you, and just getting out and being out among people. Yeah. It can be helpful, or taking a trip. Yeah. But certain things like being in a class or that kind of thing, or being in a structured environment where you're expected to do certain things might be more difficult. So just right there, being aware of your stressors and being aware of things that reduce stress, I think is a key thing. Just knowing yourself and self-awareness, and you can avoid those things that cause stress or change the situation, as we mentioned before. It was do more of the things that help to reduce stress.
It was a couple of years ago. I went back to this place in Benton Harbor. It's at Michigan Works. Ever hear of it?
Mm-hmm. Yeah.
And they want me to take up some culinary arts. I didn't care for that at all.
Okay. Mm-hmm. Yeah, I mean, obviously, if you're looking for employment, it has to be something you're interested in and something you feel confident that you can do. So that's
but that's what they thought I should be doing. It's culinary arts, and I don't care to cook that much.
Right. So that's not really a good match. So that's a case of being assertive and communicating and making sure that they're aware that that's not really what you want to do, and letting them know about here are some things I'm interested in, here's some things I'm good at. Yeah. Let's try and find a match there. So, okay, other comments or challenges that people have had? Okay, other questions?
Lisa again,
yep.
With my teenager. Since one of the things, I mean, just developmentally as her being a teenager, is all these things sound great. I think it's hard a lot of times for teenagers to get themselves in a routine. Oh, yeah. And they certainly don't want to hear it from their parent sometimes. Any advice on how to encourage them to be proactive in doing these things that are going to ultimately help them?
Well, I think, certainly I think sitting down and talking with her and emphasizing the fact that these are all things that are meant to help her, to keep her stress down, that everybody gets stressed, that being stressed is not something that's her fault, but that there are some things that she can learn to do to take good care of herself and control her stress. There are many of the relaxation techniques that she might, roll her eyes and say, I'm not going to do that. That's silly. Because when I work with teenagers, that's the reaction I often get is, really, you think I'm going to do this every day? But they need to try it. They need to see that, oh, okay, I did feel a little better after I did that, and then pick the things that work for them. It doesn't always have to be things like the visual imagery or the breathing. It can be an activity. It could be taking yoga. It could be going to the gym and doing something in particular. So even physical activity has an amazing impact on the stress level.
Okay.
Yeah, I think having them set their own goals rather than you saying, I'd like you to do this and this and this.
Right.
Having them choose their own goals and the amount of time they're willing to commit and the type of activities that they're willing to do. That's the other key. It has to be something that they find helpful, and so that may mean trying several different things until they find something that they're comfortable with, and then that they're going to be more motivated to follow up on that, and if it's something they've chosen and something that they enjoy.
If I can, real quickly, I will share kind of a funny little story with a teenage patient that I had several years ago. Boys are notoriously, reluctant to be in therapy anyway. And he'd listen to me, we'd talk, and then when I tried to teach him some stress management techniques, and I said, I want you to do these every day, I want you to find the time. I mean, he kind of rolled his eyes, and I knew very well when he walked out of the office he wasn't going to be doing any of that. And then it happened that in between a couple of sessions, he and his family went on a camping trip, and somehow he got himself lost in the woods. And of all things, he thought about me and the breathing technique, and he told me, and I gave him credit because he didn't have to tell me. He could have just said, oh, I'm not going to let her know this worked. But he leaned against the tree and he calmed his breathing down because he felt a panic attack coming on. And when he'd gotten himself calmed down, he actually found his way back to the campsite. And the next time I saw him, as much as he hated to, he said, I have to tell you something. So, he found out it worked. Him actually seeing that it worked made a huge difference. Now, whether he continued to do it, I don't know, but at least he tried it.
And that immediate response is going to be much more of a motivator than the potential long-term benefits of stress management, because teens, their brains just aren't capable of understanding, looking ahead that far. It's I think finding something that has an immediate effect that they can see, okay, this is actually helpful. And also, if it helps to reduce seizures, that's got to be a huge motivator as well.
Mm-hmm.
Okay. All right, well, we will wrap it up, and thanks everyone for participating, and I hope this is helpful to you. I hope that you'll go back and use those techniques and look for other ones to incorporate into your life. And thank you so much, Andrea, for your help. This is
You're very welcome.
Very enlightening
Thank
and
you.
relaxing and encouraging, and
good.
We'll say goodbye to everyone. So thanks again,
All right.
everyone.